You're listening to Heart Matters on ReachMD. I'm Dr. Mary Katherine Cheeley, and I'm speaking with Dr. Kevin Maki, who's the current president of the National Lipid Association and the founder of Midwest Biomedical Research. Dr. Maki, thanks for joining me today.
Thanks. Pleasure to be here.
So, at this year's American College of Cardiology Annual Scientific Session Expo, we have the pleasure of presenting on a session for statin intolerance. What can our colleagues expect to see at this session?
Well, we're going to talk a bit about a couple of statements that came out from the National Lipid Association about statin intolerance. And that includes a definition of statin intolerance, some strategies for dealing with patients who have statin intolerance, and recommendations for making sure that patients are adequately treated to manage their LDL cholesterol levels.
I love that. I think that that's one of the things that I'm looking most forward to about the discussion is how do we identify these statin intolerant patients? But then more than that, what can we do to still get them to their goal? Because it's important that just because someone can't take a medicine, it doesn't mean that we throw up our hands and we don't know what to do. We really kind of give our audience different strategies, which I think is really fun. But let's step back. So how did we define statin intolerance in our most recent statement?
The key elements of statin intolerance are that these are adverse effects that are associated with statin therapy and that resolve or improve when the statin is either discontinued or the dose is lowered. And statin intolerance can be complete, where a person can't take any dose of any statin, or it can be partial, where a person has an inability to tolerate the dose that's necessary to meet the therapeutic objective for that patient. And that's a new element, the partial statin intolerance. And one of the things that I think is important is that even if a person can tolerate a small amount of statin, then additional medications can be added to meet that therapeutic objective for a patient whose risk justifies doing so.
What are some of the strategies that we're going to go over or that we're going to talk about when approaching a patient with statin intolerance?
Well, I think the main objective is to get the LDL cholesterol level down and keep it down, because we have very good evidence that lower for longer is better for LDL cholesterol when it comes to cardiovascular disease risk. And so what we don't want clinicians to do is to spend months and years trying to find a tolerable statin regimen that the person will follow. And so for high and very high risk patients, we want to make sure that other medications are tried to get the LDL cholesterol level down if a person is struggling with statin intolerance. And so it's important to understand that whether it's a pharmacodynamic effect of the drug or it's something that is arising from the nocebo effect, it still is important to get the patient on a regimen of statin and or other medications to control the LDL cholesterol. And that might involve regimens like every other day statin or once a week statin, and then other medications may be needed to help the patient get to the therapeutic objective for LDL cholesterol.
So I am getting so excited about this one. But what are some last key takeaways that you want our colleagues to take from our presentation?
Well, I think the most important takeaway is, again, lower for longer is better when it comes to LDL cholesterol and atherogenic lipoproteins. And it may take some trial and error to find a statin regimen that patients can tolerate, but it's worth the effort because we know that about half of patients with ASCVD are not on a statin. And that means that there's a lot of suboptimal control of LDL cholesterol and atherogenic lipoproteins. And we really need to work hard to improve that situation.
Absolutely. Dr. Maki, it has been such a pleasure chatting with you today. And I'm really looking forward to seeing you on Saturday and doing our presentation at this year's ACC. Thanks for joining me this morning.
Me as well. Thank you so much for inviting me.
For ReachMD, I'm Dr. Mary Katherine Cheeley. To access this and other episodes in our series, visit reachmd.com/heartmatters, where you can be part of the knowledge. Thanks for listening.